Good evening, everyone. My name is Margaret Ashu. I am a BSN to DNP student at Brandman University. Today, I'm going to talk about blending traditional medical practices into the Western health system. So, why is that important? We see that as the United States population become increasingly diverse and multicultural, many immigrants come in with different traditions and culture. So it is very critical for healthcare workers to understand and to effectively take care of people from different cultural backgrounds. Providing cultural competent care influences both the outcome of treatment and reduces healthcare costs. So I'll be focusing today on Southeast Asia, and it's going to be about the Hmong in particular. The Hmong is a diverse group. So before I continue, I want to talk a little bit about Hmong. The Hmong is a nomadic group of people that originated so many years ago from China. They were driven from China by the Chinese War and later on settled in Laos, Vietnam, and Thailand. Because later on they did become American allies, and they helped American win the Vietnamese War. And because of that, they weren't welcome in their settlement. So some of them were forced to immigrate to the United States. And as the years go by, they bring in their families, and so we do have a decent population of the Hmong in the United States now. The Hmong has very different culture, diverse culture, and traditional way of healthcare that is parallel to the healthcare system in the United States. Before I go further, I want to talk about the patient scenario. So I had a 40-year-old monk female who has never been to the hospital. This patient came to the hospital because she was having uncontrollable vomiting. When they did the lab work showed a glucose of 978. The doctor ordered insulin drip to be started, but surprisingly, this patient refused finger stick. We had an interpreter because the patient did not understand English. But no matter how hard I explained to the patient the for need to check the sugar, I could not even start the insulin drip without knowing what the sugar stick was. But this patient refused. So finally, the interpreter suggested that, fortunately for us, that interpreter was a monk also, and he suggested that we can get us a shaman. The shaman is like a religious priest, and the shaman came and talked to the patient, and the patient was able to let me do the finger stick and accepted that we can draw blood as needed. So that might be, you might be thinking, oh, why would somebody do that? Yeah, it is culture and tradition. And as the discussion goes further, I'm going to talk about why these patients do not want a finger stick or a blood draw. So I'll talk a little bit about Southeast Asia medical system, and I'll focus, as I said, I'll focus on they have this an amazing system where they believe in a supernatural power, or they call it, they can be a god or whatever they call it. But this supernatural power comes, they believe that it has like helps them with healing. So they have somebody that is like a priest. The priest is called a shaman that priest mediates between the gods and the patient. So when the patient is sick, the priest does some rites. Sometimes they do like animal sacrifices. If they want some rites, the priest might go to a journey in the forest to gain more healing powers and come back in order to heal the patient. They also use herbal medicines a lot in healing. They do other alternative meditations like acupuncture. They also have spoon rubbing, pointing, or cupping. With the spoon rubbing, pointing, or cupping, they kind of like sometimes use hot spoon or hot point and rub them around some body parts that are kind of like swollen or painful. And they believe that that takes away the pain or the swelling. So sometimes you might see them come to the emergency room and they have bruises all over their body. That does not mean they have been abused, but it's just a healthcare practice. It's a way of healing that is cultural to them. So I want to talk about some of the beliefs of the monks that is kind of a barrier to their care. First, the first thing is language barriers. So many of them don't speak English or they speak limited English. So we should try to get an interpreter whenever we want to talk to them. We have to assess their level of English. And if they need interpreter, we have to get one for them. Also, some of the beliefs that make it first, they believe in their traditional healing and they won't go to the hospital except it's very bad. So sometimes they come to the hospital late. There might be something that might have been addressed, but it becomes complicated because they wait until they finally give up on the traditional medicines before they can appear in the hospital. Also, they believe that the blood in the body is finite, and every time you draw blood, like it's not replaced. So that is why my patient was refusing for me to keep on sticking the finger and pulling out little blood to test the sugar or to be drawing blood all the time. Also, they say when you stick their finger, sometimes the good spirit goes away. So everything is about balance. They believe that there is a good and a bad spirit. So there should be a balance between the good and the bad for healing to occur. So like pricking their finger, you pose a hole, and that hole might the good spirit might lead through that hole, and now the bad spirit will become more than the good spirit, and their condition might become worse. They also believe in reincarnation. So after they die, they kind of like wake up and they will be born again um, in another generation. So if you have your body part amputated or you do like biopsy, any part of your body that is taken, that is going to mean that you will not be reincarnated. So they are so very preserved with their body parts. They don't want any part of their body to be hurt. So you see them refusing stuff like biopsy or treatment. They believe a lot on natural and alternative medicines, as we have seen earlier. They believe a lot on herbs and they believe a lot on acupuncture and other stuff like pointing and spooning and stuff like that. They also have diets that are kind of like rich in rice. They do a lot of fish and do a lot of salted food that sometimes is problematic to their health. They are family oriented. So the family is large. It's not like just mother, father, and children. They have this patriarchal family system where they have like very extensive family, and the one that whenever somebody is sick, everybody is so involved. They're always together. So sometimes our hospitals have visitation policies. We sometimes, if we actually want to take care of this patient and want them to get better, we have to ease our visitation policies on these patients or this group of patients. And for religious support, I mentioned the shaman earlier. The shaman is the mediator between them and their God. So they see that shaman as very important and they listen to what the shaman says. So we also should, as much as possible, yeah, look for a shaman that actually have knowledge of the disease process and involve the shaman and the patient's care. Also, the attitudes towards healthcare workers, they do have respect for officials, so they respect healthcare workers, and sometimes they find it like rude to disagree with the healthcare workers. So you might see among patients kind of nodding the head. We might be talking with an interpreter and they're nodding the head. That does not mean they're understanding you or they're accepting what you're saying. It just means that they are listening to you. So we should try to differentiate that. There are other things like eye contact. The monks, they consider eye contact as being rude. They also consider handshake, like females will not want to have handshake with males. And so having long handshake makes them very uneasy. So those are differences between the American culture and the Hmong culture. So we should understand that, and so we know how to treat these patients. So for specific health issues that might be addressed with the Hmong population, uh, we see that like my patient that had diabetes, diabetes is very rampant in the community. They have a higher rate of diabetes more than non-Hispanic whites, and they also have a higher rate of diabetes among like have the highest rate of diabetes in the South Asian population. Most of them are obese, and that is based on their diet of like rice and salted food. They also have a higher rate of nasopharyngeal and cervical cancer. And we see that is because they salt a lot of food and then they preserve them and eat a lot of animals. And also, hepatitis B is one thing that is so rampant in dietary, which puts them at a higher rate for liver cancer. So you can see a lot of liver cancer also in these people. And most of the time, they need to like, go into the hospital. They believe that alternative medicine works better than the hospital, and then maybe the hospital medications defile their body or might be too strong. And for a theory that I would like to apply for this South Asian group of more, I choose the Campina Bakote's theory of nursing competence. As far as cultural competence is concerned, this theory really speaks to me. The theory is talking about learning cultural competence, that it is a process. So we only have cultural gain if we put in that effort, if we continue to learn about other culture. Now, what do we do after we learn? We have to apply the skills that we have learned on our patient. We should actively and be conscious of the beliefs and culture of our patients, and we should accept that some cultures have beliefs and behaviors that are parallel to what is considered normal in the Western world. Just as I have said, in the Western world, eye contact is something that we see as professional. Our handshake, a good handshake is professional, but with the Hmong population, that is not the case. Eye contact is rude, and doing those handshake is also considered as also or inappropriate. And also, Bakute also emphasized the need of exposure, that nurses or healthcare workers need to be exposed to sites that have patients with different cultural backgrounds. So we actually, as advanced nurse practitioner, as nursing student, Bakute encourages us to go to facilities that have a lot of people that come from different culture, so we can be exposed to them. Cultural and spiritual assessment. So what should we assess for these patients? What is actually beneficial for them? Especially like my patient that have diabetes type 2. What can we preserve for this patient? So we first of all have to know their attitude towards illness. So sometimes the what one of the things that I did not talk about is that the young people, they usually believe that they only see if they can actually see. So it's either they physically see the illness, or maybe they can feel the signs and symptoms of that illness. So, for example, you tell them about HIV, they might not be able to understand the concept of HIV because they don't see HIV, or maybe sometimes they don't have no symptoms of HIV. Or you tell them about hypertension, they don't have no symptoms, they don't see no hypertension, so no hypertension does not exist. So, with diabetes, you can tell them that it is like sweet urine. Using words like that will make them understand you better. Also, we can assess the patient's attitudes towards health, since they believe that health comes about by the balance of evil and good. We should always try to use words like balance, like so, because this sugar is high, so there is an imbalance. So that is why, like you see, so we have to balance the sugar to where it is normal in the body. So that way, when you use that balance, which they already understand the concept of balance, then they will be able to understand that concept well. And we should use their spiritual leaders, those that are knowledgeable about the disease process, include them in their care plan. It's going to make it easier for us, and it's going to lead to better patient outcome. We also have to assess their attitude towards natural medicines. Most of the time, they believe that like herbs is more beneficial, it's natural, it's safe. Most of the time, those herbs they really are not harmful. So we have to assess the herbs. We have to make them understand about toxicity. Like taking it because they don't have no dosage, they might take more, and that might be harmful to them. And also, we need to tell them about like taking different kinds of herbs at the same time without knowing the contents of the herbs. That might lead to a head to herb interaction, and that one might be harmful to them. Also, we can talk to them about herbs and medication interaction because they are in the hospital and they might take some medicines from the hospital and mixing it with the herbs, it can have that herbs to medication interaction, and that might have bad outcome. Apart from that, there is no evidence that that herbs is going to cause any harm. We can just let them take it and just kind of like whatever we can do to get them better. That's all we should do. Normally, they always have one leader in the family, and that is a male leader. That is the person that is in charge of decision making. So, apart from the shaman, we should be consulting that male leader. We should talk to them. The monk, they prefer face to face discussion rather than over the phone. So, calling their leader over the phone might be considered rude. So probably we will have to actually make appointments and talk to the leader face to face. Sometimes the patient might not want to make any decision about their own care and want that leader to make the decision. So we have to follow the patient's choices and wait for the leader and actually talk to the leader. We also have to ensure that as much as possible, we should give these patients medications and not do surgery because, as I said earlier, they believe that if we cut part of their body, then they will not be reincarnated, and we don't want that. We should also look at their educational needs. What do they need? We make sure we interpret the printed materials. We give it to them both in English and in the known language. And this is a summary of what I said earlier. What can we do to achieve optimal outcome? I say we should assess the cultural, spiritual, and educational needs of our patients. We have to give them pertinent information face to face to the designated male family head. We ensure adequate privacy for all communication. We identify a shaman who is knowledgeable about the disease process and include him in the patient's plan of care. We promote medicine over surgery. Whenever possible, allow protective spiritual items like bracelets and necklaces to remain in place. And these bracelets and necklaces are very important because still for the balance between good and bad. Among they believe that the young children are very vulnerable for the big spirits to go away. So they're putting those some of the time the shaman has gone through some rituals to get those bracelets bracelets ready to put it around the patient's roof or arm. So if there's no procedure that is contraindicated, we can leave those bracelets and armbands like in place. And as I said, we do printed materials to kind of like explain with simple drawings to explain what we are doing to the patient. What impact does that have to us as advanced practice registered nurses? As advanced practice registered nurses, we're supposed to learn all we can about other culture. We have to respect the cultural beliefs of our patients. We need to understand our own bias about certain cultural practices and put them aside. We identify the patient's culture from their answers and reactions to our interview questions. And please use an interpreter when necessary. That is the end of my presentation. Thank you.